So this vaccine's been developed over a number of decades, following a collaboration between GSK and the Walter Reed Army Research Institute. It was recommended by the WHO a number of years ago and completed its pilot implementation program in 2022, and very positive results came out of that program, which have supported the wider rollout of the vaccine starting now in Cameroon.
Yeah, it has remained a very persistent problem for particularly African countries, hasn't it, malaria, and particularly children?
Absolutely. So in 2022, there were 249 million cases of malaria and 608,000 deaths globally, and 95% of these are in Africa. There is no doubt that the RTSS vaccine and also the R21 vaccine are going to play an important role in reducing malaria-related illness and death. I think it's important to note, however, that this is not the end game. The RTSS vaccine has an efficacy of only 40%. And following the last dose, its effectiveness does drop quite dramatically. So we still do need more effective vaccines. We still need to work on them, like the one we're working on at Griffith University, if we want to better control and ultimately eradicate the parasite.
Yeah. What are the complexities of a rollout like this in a country like Cameroon?
I think one of the biggest challenges is going to be disinformation. We certainly saw that with the COVID vaccines and how it was propagated through social media. It will be very important, and I know the Cameroon government is very conscious of this, to ensure that healthcare workers have up-to-date knowledge in relation to the vaccine, that there is very good community engagement, so there's the opportunity for discussion around concerns and vaccine hesitancy, and that parents are able to understand the advantage of this malaria vaccine as a prevention tool in infants. It's not going to replace current tools, it's to be used alongside those tools.
And so that in itself could present complications, particularly in smaller communities, rural communities. Are they travelling out? I noticed that the sort of take-up is quite low at the moment.
So it's only just been launched in Cameroon, and I know that supporting partners like Gavi, the Vaccine Alliance, UNICEF and WHO are really playing a role on the ground in bolstering awareness of the vaccine in preparation for the launch, so that there is a really good understanding of the positive impacts and the benefits of allowing your infant to be able to have access to this vaccine.
Yeah. Are there other countries looking to use it as well?
Absolutely. So Gavi, the Vaccine Alliance, actually launched a special funding program to enable vaccine access for countries, poorer countries, I guess, is the best way to put it. And a number of countries, including Cameroon, have been able to access this program for their vaccine rollouts. So in addition to Cameroon, there are about 9 other countries that are looking to roll this vaccine out. Sierra Leone and Liberia are 2 examples who are hoping to roll this vaccine out later this year.
And what is then the supply capability?
Yeah, it's a really good question. It's estimated that between 80 to 100 million doses of malaria vaccine are going to be needed each year. And we know based on current supply that there'll be insufficient doses of RTSS available for all children who are recommended to receive the vaccine. So last year, when the WHO recommended the R21 malaria vaccine as well, I think part of the excitement was that we hope that this vaccine can make up the shortfall in vaccine supply. So all children who are recommended to receive this vaccine will be able to do so.
And so then just double checking, it's going to be needed every single year. They're going to have a sort of a top up.
So my understanding is that infants will become eligible when they become 6 months of age. They receive their first dose at 6 months of age, and then 2 subsequent doses 1 month apart, and then a 4th dose just over a year later. And I did read that children who are living in areas of very high levels of malaria may be able to access more frequent booster doses following that 4th vaccine dose to keep their immunity up and to protect them against malaria.
Yeah, really exciting development. Great to have you on, Danielle. Thanks so much.
Thank you very much.